So in this session, this is the second session of the peritoneum. In this session, we'll be dealing with the peritoneal folds. The following are the few important peritoneal folds: lesser omentum, greater omentum, transverse mesocolon, gastrosphenic ligament, lienorenal ligament, sigmoid mesocolon, like that. So if you use the term omentum for any peritoneal fold, it means that it connects stomach with the other abdominal organs. If you use the term mesentery, these are the folds which suspend the gut from post-abdominal wall and convey nutrition and innervation to gut. The same mesentery, if it is suspending the large gut, so then we call it as mesocolon. So most folds convey both arteries and veins. Few folds convey only arteries, like left gastropancreatic fold, which conveys left gastric artery, and right gastropancreatic fold, which conveys hepatic artery. So one fold conveys only vein, that is paraduodenal fold, which conveys inferior mesenteric vein, and few folds does not contain any significant structures. One such fold is the inferior ileocecal fold. So this is also called as bloodless fold of Treves. So now we'll deal with the mesentery. Here you can see the mesentery. This is the mesentery, this is the transverse mesocolon, and this is the sigmoid colon. So mesentery is a broad fan-shaped fold of peritoneum. It has two layers, both derived from greater sac. Presents two borders, vertebral border and the intestinal border. If you see the vertebral border, it's also called as root. It's approximately 15 centimeters or 6 inches. So above, it is attached to the left side of the L2 vertebra at duodenal genital flexure. Below, it is attached to the right sacroiliac joint. It is at the ileocecal junction. So structures crossed by root are as follows, like the third part of duodenum, abdominal aorta, inferior vena cava, right gonadal vessels, right ureter, right psoas major, right genitofemoral nerve, right sacroiliac joint. You can see here the third part of duodenum, abdominal aorta, inferior vena cava, right gonadal vessels, right ureter, genitofemoral nerve, and it will be attaching here to the right sacroiliac joint. Then the free border is 20 feet long and it is frilled. It encloses jejunum and ileum. The contents are jejunum, ileum, jejunal and ileal branches of superior mesenteric vessels, intestinal lymphatics known as lacteals and mesenteric lymph nodes, which are approximately around 100 to 200, loose areolar tissue, plexus of nerves around blood vessels, fat. Occasional contents are accessory supraannular tissue, suspensory muscle of duodenum, tip of the vermiform appendix. Now we'll go with the transverse mesocolon. Here you can see this is the transverse mesocolon. It's a broad peritoneal fold, suspends transverse colon from the post-abdominal wall. You can see here clearly this is the transverse colon, which is suspended by the transverse mesocolon. It has two layers. So in early life, both layers are derived from the greater sac, but after puberty due to zygosis, upper layer derived from lesser sac and lower layer derived from the greater sac. It has two borders, anterior and posterior, and two surfaces, anterior superior and posterior inferior. I'll show you here. If you see here, this is the primitive transverse mesocolon, where both layers are derived from the greater sac. This is the lesser sac. So this is the greater sac. Both layers are derived from the greater sac. But, so this is the alternative position. If you see, this is the transverse mesocolon, where the anterior layer is derived from the lesser sac peritoneum and the posterior layer is derived from the greater sac peritoneum. So what is happening here? These two layers will disappear by a process called zygosis. I'll show you what is zygosis here. See here. So this peritoneal fold and this peritoneal fold, both when comes in contact, they disappear by a process of zygosis and will be replaced by connective tissue. Okay. So what is happening here? So if you see the peritoneum, if any structure from the beginning itself, if it is behind the peritoneum, we call it as retroperitoneal. That is primary retroperitoneal organ. But if you see any structure, if it is in the beginning, it is completely surrounded by peritoneum, but after gut rotation and due to some changes, if it becomes retroperitoneal, those kind of structures are called as secondary retroperitoneal organs. Primary retroperitoneal organs are behind the peritoneum from the beginning, but secondary retroperitoneal organs are initially completely surrounded by peritoneum on all sides, but due to changes, certain sites they lose peritoneum and they come behind the peritoneum. So these kind of structures are called as secondary retroperitoneal organs. So in early life, both layers of the transverse mesocolon were derived from the greater sac, as I have shown in the earlier diagram, but after puberty due to zygosis, upper layer derived from the lesser sac and lower layer is derived from the greater sac. Now let us continue with this. Two borders are there, anterior and posterior border, and two surfaces are there, anterior superior and posterior inferior surface. anterior border attached to the posterior surface of the transverse colon. So here it is transverse colon, it is not transverse mesocolon, along the tinea mesocolica. Then posterior border is attached along the anterior border of the body and anterior surface of the head of the pancreas. Anterior superior surface related to stomach, separated by cavity of lesser sac. Posterior inferior surface related to third and fourth parts of the duodenum, duodenojejunal flexure. Upper end of root of mesentery, coils of jejunum. The contents in the transverse mesocolon or the transverse colon, anastomosis between middle colic and left colic vessels, nerves and lymphatics of the transverse colon, loose airway tissue and fat. So this is the sigmoid mesocolon, which is V-shaped. The apex is directed above. You can see here apex is related to the left ureter. Now let us see the details of it. You can also see the sigmoid colon being suspended by the sigmoid mesocolon. So it is inverted V-shaped peritoneal fold, suspends sigmoid colon from posterior wall of the pelvic cavity. Apex of the V situated in front of the bifurcation of the left common iliac artery, and left ureter enters the pelvic cavity behind the apex in posterior wall of the intersigmoid recess of the peritoneum. I'll show you the intersigmoid recess at the end of this session. Then left limb attached along the left pelvic rim up to the junction of descending colon and sigmoid colon. So right limb attached to the pelvic surface of the sacrum, extending from left sacral joint to the middle of the third sacral vertebrae. And the contents of the sigmoid mesocolon are as sigmoid colon, sigmoid vessels, branches of suprarectal vessels, and then nerves and lymphatics supplying sigmoid colon and loose airway tissue and fat. So now you can see this is the mesoappendix. You can see here this is the mesoappendix. So this will be the inferior ileocecal fold. This is the mesoappendix. So mesoappendix is a triangular peritoneal fold, invests entire appendix derived from posterior layer of the mesentery of ileum. Appendicular vessels pass within the free margin of the mesoappendix. So now lesser omentum, you can see this is the lesser omentum. It has two parts. The part which extends between liver and stomach is the hepatogastric part, and the part which extends between the liver and duodenum is the hepatoduodenal part. So this is attached along the lesser curvature of the stomach. Let us see here. This is a double layered peritoneal fold, connects stomach and proximal 2.5 cm of the duodenum to the liver. Anterior layer is derived from the greater sac and posterior layer is derived from the lesser sac. Liver attachment is J-shaped. Horizontal limb surrounds porta hepatis. Vertical limb attached to bottom of fissure for ligamentum venosum. And there are two parts: the hepatogastric part between stomach and liver, and the hepatoduodenal part between duodenum and liver. At right end of porta hepatis, both layers of the lesser omentum are continuous and form right free margin, which forms anterior boundary of the epiphytic foramen. The contents of lesser omentum are along the lesser curvature, gastric nerves, anastomosis of right and left gastric vessels and lymph nodes. And along right free margin, it will be having three important structures, namely the portal vein, bile duct, and hepatic artery, and a few plexus of nerves and hepatic lymph nodes. Then tracings. Below, at lesser curvature, two layers separate to cover stomach. Under greater curvature, continue with anterior two layers of the greater omentum. Above, the anterior layer reflected to diaphragm as left triangular ligament. Posterior layer covers caudate lobe of liver and is continuous with inferior layer of the coronary ligament of liver. And right side, they form the right free margin. So left side, two layers separate to enclose stomach at bare area of cardiac end of stomach. Posterior layer reflects onto the left crus of diaphragm as gastrosplenic ligament. Now, this is the greater omentum, which is attached along the greater curvature of the stomach. Largest peritoneal fold connects stomach to the transverse colon, hence called gastrocolic omentum. Two sheets, anterior and posterior. Each sheet has two layers. Total 4 layers constitute greater omentum. First layer is continuous with the fourth layer, greater sac peritoneum. Second layer is continuous with the third layer, lesser sac peritoneum. Anterior sheet has first and second layers attached to greater curvature of stomach and duodenum. It descends to variable extent to form lower free margin, where it is continuous with the layers of posterior sheet. Posterior sheet has third and fourth layers, ascends upwards attached to anterior superior surface of the transverse colon along tinea omentalis. So in fetal life, the fourth layer of the greater omentum extends above the transverse colon and reaches the anterior border of the pancreas, as I have shown in the earlier picture when I was dealing with the transverse colon. So then this reflects downwards and forwards to enclose transverse colon as bilaminar primitive transverse mesocolon and returns to anterior border of the pancreas. Thus, fourth layer of the greater omentum and primitive transverse mesocolon are separable from each other by embryological bloodless plane. So in later part of life, these two layers disappears by zygosis. Eventually, fourth layer of greater omentum invests anterior-inferior surface of the transverse colon and continues with the inferior layer of the transverse mesocolon. And even the third and fourth layers separate to enclose transverse colon and continues with the upper and lower layers of the definitive mesocolon. You can see here. So this is the primitive transverse mesocolon. See, The third and fourth layers of the greater omentum are separate and the transverse mesocolon is separate. But what happens here? You can see the third layer will cover and continue as the anterior layer of the transverse mesocolon. And the fourth layer of greater omentum will continue as the posterior layer of the transverse mesocolon. So this is the adult pattern, whereas this is the embryological pattern. So contents: between the first and second layers, right and left gastroepiploic vessels and lymph nodes. Between second and third layers, lower recess of the lesser sac in the early life, but after puberty, recess obliterates. Then between third and fourth layers, blood vessels derived from gastroepiploic vessels extend longitudinally, and some fat, areolar tissue, and there are milky spots which are the aggregation of macrophages. The function is it is storehouse of fat, and it also wraps inflamed organs, prevents infection, and acts as abdominal police guard. So you can see this is the anastomosis between the gastric epiploic vessels, and you can see these are the gastric arcades, and you can see these are the epiploic arcades. You can see here this is the third layer which is continuing with the second layer, and you can see this is the fourth layer which is continuing with the first layer of the greater omentum. And clearly you can see the third layer continues as the anterior layer of transverse mesocolon, and you can see the fourth layer continues as the posterior layer of the transverse mesocolon. Gastrosplenic ligament: it is a double-layered peritoneal fold, connects stomach to the upper lip of hilum of spleen. Anterior layer is derived from greater sac peritoneum, posterior layer is derived from lesser sac peritoneum. Contents: short gastric and gastroepiploic vessels. Below continues with the anterior sheet of greater omentum along left rim margin. Above continues with gastrophrenic ligament. So behind continues with the lienorenal ligament. Yeah, these tracings I will be explaining properly in horizontal disposition of the peritoneum. Then gastrosplenic ligament is the triangular peritoneal fold derived from lesser sac. So it is not gastrosplenic ligament, it is gastrophrenic ligament. So gastrophrenic ligament, it's a triangular peritoneal fold derived from lesser sac, connects bare area of cardiac end of stomach to the left crus of diaphragm. Please remember this is gastrophrenic ligament. So this was the gastrosplenic ligament. So here we are dealing with the gastrophrenic ligament. It is a typographical error. So we are dealing with gastrophrenic ligament. Triangular peritoneal fold derived from lesser sac, connects bare area of cardiac end of stomach to left crus of diaphragm. At apex of bare area, lower end presents a lower free margin. So contents: left gastric artery, sometimes a left suprarenal gland, sometimes a part of the left suprarenal gland also will reach the gastrophrenic ligament. Lienorenal ligament, it's a double layered peritoneal fold, connects anterior surface of left kidney with the posterior lip of hilum of the spleen. Contents: splenic vessels, nerves and lymphatics, and tail of pancreas. In front, gastrosplenic ligament, below it contains posterior sheet of greater omentum. Phrenicocholic ligament, it's a triangular peritoneal fold, extends from left colic flexure to the diaphragm, opposite 10th and 11th ribs, supports spleen from below, so-called sustentaculum linus. Lienophrenic ligament or phrenicosplenic ligament, it's upward continuation of lienorenal ligament, connects medial end of hilum of spleen to the diaphragm, suspends spleen from above, so-called as suspensory ligament of spleen. So, sustentaculum linus is phrenicocholic ligament, whereas suspensory ligament of spleen is lienophrenic ligament. Then falciform ligament, it is sickle shaped, has two layers, connects liver to undersurface of diaphragm and anterabdominal wall up to umbilicus. Convex margin attached to diaphragm and anterabdominal wall up to umbilicus. Concave margin attached to anterior surface of liver between anatomical right and left lobes. Free margin extends from umbilicus to the inferior margin of the liver, contains ligamentum teres hepatis. Contents: ligamentum teres, paraumbilical vein, accessory portal system of Sape. So these are numerous small veins which communicates paraumbilical vein with the diaphragmatic veins. You can see here this is the falciform ligament. This will be the attached margin, this will be the free margin. This is the convex margin, this is the concave margin, this is the free margin. So here is the location of the ligamentum teres hepatis. So coronary ligament connects bare area of liver with the diaphragm, has two layers, superior and inferior layers. Superior layer is peritovisceral, it's from liver to diaphragm. Inferior layer is intervisceral, it reflects from liver to right kidney as hepatorenal ligament. Contents: connective tissue containing branches of right inferior phrenic artery and communications between systemic and portal veins. So upper part of right suprarenal gland sometimes and upper end of right kidney. You can see here this is the superior layer of coronary ligament, and below this you can see in other sections there will be inferior layer of coronary ligament. Both will be enclosing the bare area of liver. So at the apex of the bare area of the liver, both coronary ligaments, superior and inferior layer of coronary ligaments, will continue towards the right side as right triangular ligament. Right triangular ligament connects right lateral surface of the liver with the diaphragm, forms apex of bare area of liver. Left triangular ligament connects upper surface of left lobe of liver to the diaphragm, overlaps the front of abdominal part of esophagus. So this is the left triangular ligament and this is the right triangular ligament. Broad ligament. So broad ligament of uterus, it is a double-layered peritoneal fold, extends from lateral border of the uterus to the lateral pelvic wall. Developmentally, they formed from mesenteries of paramesenteric ducts. There are two surfaces, anterior, inferior, and posterior superior surface, and four borders, upper, lower, medial, and lateral. So whenever the peritoneum reflects from rectum onto the uterus and from uterus onto the urinary bladder in the female. So this reflection forms the broad ligament on either side of the uterus, which we deal more prominently when we are dealing with the supports of uterus. Here time being, because it is one of the large peritoneal fold of clinical importance, we are mentioning it here. You will understand this broad ligament when you study it along with the gross anatomy of the uterus. The contents of the broad ligament are uterine tubes, round ligament of uterus, ligament of ovary, ovarian vessels, uterine vessels, tubules, and duct of epiphoron. So these form the duct of Gartner, and these are the remnants of cephalic part of mesonephric tubules and tubules of paraphoron. So these are distal mesonephric tubules remnant, and then lymphatics and nerves sometimes access the suprarenal tissue. So parts of the broad ligament are mesosalpinx, you can see here. So this is the mesosalpinx in relation to the fallopian tube, and mesoovarium in relation to the ovary. So here you can see this is the mesoovarium, and mesometrium, the remaining part of the broad ligament, which is in relation to the body of the uterus. Peritoneal recesses, these are small pockets or fossa in the peritoneal cavity bounded by folds of peritoneum. So clinically important, as coils of small intestine pass into it, internal herniation, and they might get strangulated also. So a few known recesses are duodenal recesses, superior duodenal recess, inferior duodenal recess, paraduodenal recess, retroduodenal recess, and duodenal recess, and intersigmoid recess. You can see here the superior duodenal recess, inferior duodenal recess, paraduodenal recess, and retroduodenal recess. And you can see this is the intersigmoid recess. So in the next session, we'll be dealing with the vertical disposition of the peritoneum. Thank you.